Welcome everyone to the African Social Work Network. My name is Jacob Rugare Mugumbati. Today we have Dr. Edmos Mthethwa from the Department of Social Work, University of Zimbabwe. He is going to talk with us about social work in Africa. Welcome, Doctor, to this platform. To begin with, could you please tell us about yourself?
Thank you. I am Dr. Edmos Mthethwa, a social worker by profession and training. Um, you know, um, I practice the social work, in Zimbabwe, which is statutory social work, for that matter, for close to a decade before joining the academia, as a social work lecturer. Currently senior lecturer, in the Department of Social Work, University of Zimbabwe. I have quite a lot of research interests. I think I have, close to 50 or so publications, in my name in the field of social work, social policy, and disability studies. My area of interest is social policy. I think that's the brief about myself.
Oh, thank you. Telling us about yourself. Would you mind telling us about your social work education?
Thank you. I trained at the School of Social Work, University of Zimbabwe, where I attained my Bachelor of Social Work degree, honors. I thereafter, joined social work practice, like I said before, where I also, because of my practical practicing, context, had to, pursue other social science or related qualifications, even in the area of business studies. And, I then had to come back to social work to pursue, my Master of Social Work degree, after attaining two other master's degrees, in other disciplines. It was after my Master of Social Work degree that I then, decided to join the academia, as a social work lecturer, upon which I had to, enroll for my, doctoral studies, in the field of social work, majoring in, disability, and public policy. Um, I then, did quite a lot of research in those areas, like I said, before. In a nutshell, that's my, social work education, history.
Thank you. Thank you so much for that. I've got two follow-up questions based on what you told us. The first one is about the publications that you talked about, over 50 plus. Congratulations, that's good work. Would you, in a nutshell, tell us about the major themes in your research?
Basically my major theme in my research revolves around my general conviction or approach to, social work, professional practice and education. Which area is, social policy, the empowerment approaches to social work practice, even in the context of vulnerable, populations such as persons with disabilities. So most of my publications therefore revolve around, those areas, the emancipatory approaches, including analysis of existing policies, ways of improving general and generic social work, education and practice in the country, and beyond. Yeah.
Thank you. Thank you very much. Your response also attended to my other question, which was about the police issues that you deal with. So we move on to the next question. My next question is about the social work and other organizations that you are involved with. Would you want to give us a brief about those?
Thank you very much. Because of my pursuit of an emancipatory or empowerment agenda, as a core facet of the social work profession, I subscribe to, the human rights discourse. And I work with quite a number, of organizations, that pursue that agenda. Of immediate, notice and importance to these organizations, among these organizations, of course, are organizations of and for persons with disabilities, that I help with the advocacy work. I research, and also, general policy literacy, and programming. And these include, among others, the Federation of Persons with Disabilities in Zimbabwe, which is an umbrella body, of organizations of persons with disabilities, and as well as the National Association of Societies for the Care of the Handicapped, which is an organization for, an umbrella organization of organizations for, persons with disabilities, which are service organizations. And, the whole idea there is to bring forth, introduce, and even, make, them internalize the social work flair, in within those kind of, organizations. And last but not least, this is over and above, similar work with the, international agencies in the area of disability and policy, like, the UN family, particularly UNESCO here, and the United Nations Development Program. That is, then the last but not least, we have been, I am also an active member, of other purely social policy, oriented organizations. Like, I am a specialist in social policy, and by the same token, in social protection, social security, issues. To that effect, I'm an active member of the Southern African Social Protection, Experts Network. In that vein, also, I am involved in just assisting even government locally here to, in setting up, a number of, programs that are meant to ameliorate the lives, of people living in poverty in need of social, protection services. Thank you.
Thank you. Thank you very much for informing us about the various organizations you work with. Related to that is the work that you do as editor of the African Journal of Social Work, and you have been in that role for quite a number of years. In summary, what have you learned from being editor of the African Journal of Social Work?
Thank you. I have learned quite a lot from, from that exercise. One, that people can grow an idea from scratch, and sustain it. I think this is a remarkable stride that the National Association of Social Workers Zimbabwe has managed to do, together with the editorial team that continue to be dedicated. So that's a good lesson. The other lesson is also a very interesting one. Is that the field of writing, publishing, and research is an interesting one. With a number of upcoming researchers and writers coming on board. And but of interest is the need to craft programs, I suppose, funds permitting, to train these men and women, particularly those in practice, to be good writers. The quality of papers, and the volume thereof would suggest that, there is quite a lot of appetite, to research, appetite to publish, appetite to communicate practice experiences that only needs to be harnessed properly, coached and, directed, so that we are able to really have future writers. Last but not least, on that issue is the issue of you know that once a journal becomes very consistent, reliable, and sometimes accessible, it attracts wide readership, across, the African continent, to an extent that, a journal that started with one issue came to two issues. Now there's need for four or more, issues per year, just on account of huge public demand, you know. And then, to me, that's a plus on the part of the editorial team. It is a plus on the part of the National Association. Thank you.
Thank you very much. I do agree on you on that one. Thank you again. My next question is about looking at social work in Africa broadly. What opportunities do you see? What challenges do you see? And how can we solve some of these challenges?
Thank you very much. Social work in Africa, for me, has got quite a lot of opportunities. Admittedly, it is a fairly new profession, uh, you know, brought forth by, globalization and westernization, of, African societies and communities. It is, because of that, a profession that is also, unfortunately, came rather late and found other professions already entrenched, which then makes the need to aggressively probably find your feet, and the relevance quite urgent. But it is a profession that is coming within a certain socio-cultural and economic and political context that is quite different from, the socio-cultural and economic context of, the countries and societies, of origin. And then there is quite, that presents some kind of opportunities, to one, indigenize, the profession by making it more responsive to the, socio-cultural, and political and economic, circumstances, of Africa. By this, is meant an opportunity endemic in Africa, for probably, the philosophy within the context of the philosophy of Ubuntu, Unu, or African spirit of communalism, um, African, ethos, of collectivism, um, you know, collective problem solving, um, collective, conflict management. For even example, the value that the African societies and communities cherish of peace and pursuing peaceful, coexistence, pursuing local, economic development, valuing, a robust and good family, institution, valuing the sanctity of the family, institution, including marriage, upbringing of children, valuing collective or communal approaches to child welfare and to child, you know, um, uh, upbringing, wherein children then come to belong not to this or that family, but belonging to the whole community, with the all adult members of that community having the right, to nurture, the right to correct, and the right to, grow or bring up, a child within the confines of locally cherished, communal values and ethos rather. For me, that's a fertile ground of opportunity that social workers must seize and then ensure, that they propagate, ensure that they nurture, that kind of a spirit to the advancement, of child welfare, to the advancement of, you know, even the problems associated with, other vulnerable children, other vulnerable, groups, in society. Last but not least, the other opportunity that I see is also that Africa is a conflict region, continent, particularly on account of the varied, developments, political developments, on the continent. And the social work for me may need to do more to exploit, this window, of opportunity for the furtherance of the growth of the profession, particularly the aspect of conflict resolution, conflict management, peace building, and the related, areas where I feel probably other, disciplines have even really exploited. And this then also resonates well with the current discourse, that so the profession is taking around human rights and the social, justice. So the impediments that we currently have is that social work has not been able to really practically define, and internalize, and practice, you know, the human rights and the social justice, aspects of it, at a macro, level. What we instead see are micro, sporadic, erratic, if you may call it, approaches to, social justice through child welfare advocates, and related, issues. So that has tended to trivialize the profession. That has tended to, make it, sort of of less importance than the other, entrenched and esteemed professions. So there is quite a lot of, effort that social workers need to really, invest in making sure that social justice and the human rights, agenda receives the primacy in their dealings with society. Thank you.
Oh, thank you very much. That was an in-depth analysis of the situation of social work in Africa, and I liked it when you started with the impact of globalization and westernization on African social work, but then we went on to talk about the opportunities that are there in terms of indigenous knowledge systems, indigenous approaches, and the like. So thank you so much for that. So I'm now wondering if indigenization is your preferred model of social work, or you've got another one to share with us.
Thank you. I think the issue is that, contrary to conventional wisdom, maybe if I may say that,
Yes.
the social work interventions have had their own challenges, particularly to African contexts, largely because they've been more or less Western. They've also been more or less, transient, if you want to call it, or temporary, and they lack the sustainability. Because but at the same time, were blamed for creating dependency, particularly the casework modeling that, used to comprise, the bulk of social work practice, right from the Elizabethan poor laws through to the charity organization society, and the social work practice imperatives that were brought into, the former British colonies, and so on and so forth. So the process of indigenizing, social work is therefore, akin to a process where we merge social work within the development, processes, of Africa. I think I have made allusions to, the way in social work, the profession can seize, opportunities that are endemic, in the African, cultures and contexts, of Ubuntu, the philosophical foundations undergirding, child protection, child rearing, the philosophical foundations surrounding, generally, ways of, human life, general conduct, of community life, the sanctity of the family, all that needs to be reorganized and repackaged so that it becomes part and parcel of the DNA, part and parcel of the social work mantra. Once that happens, we can now start talking, about how going forward we can, embrace, you know, um, this kind of indigenizing, of social work within the context of empowerment and development, agenda, where we even in our social welfare programs, entrench a developmental, approach, self-sustainability, self-sufficiency, self-reliance, programs, and the related programs that speak to people's ability, within their small means to fend for themselves. Thank you.
Thank you very much. That was another a very detailed response. Now I move on to my last question. It's a long one and it has got several options. Feel free to pick what you want to respond on. Is there anything you'd want to share with viewers and readers? For example, career advice, what you are currently working on, your greatest achievement to date, or your personal story? If there is, please share with us.
Thank you very much. I will, just give you a summary of, issues that I think are important. Starting at a personal level, going to, the professional, and broader, practice context. I've dedicated quite a lot of my, you know, uh, time in this career, towards the promotion, of the human rights and the social justice discourse within the context of, developmental social work. And my niche, yes, they've been, social policy, in the context of, ameliorating the, plight of persons with disability. Like I said beforehand, the understanding here is that, our models and of intervention as social workers may not be sustainable, for any population groups, even, persons with disabilities. Most of the time, persons with disabilities have always benefited from, charity. But unfortunately, within the socio-economic fundamentals of Africa, the economic base is not as good as in, that would allow a sustained, charity work, so to say. So at one point in time, you would want those people to graduate from charity to self-sufficiency and self-reliance. So what I have then done is to champion research that, stipulates that persons with disabilities, just also need, economic and political power. With the economic and political power, these people can fend for themselves without outside help. The majority of them, for that matter, can even do without charity, because they can leverage on that economic power, they can leverage on that political power, and fend for themselves. It is in that context that I've pioneered quite a lot of work that, together with others, yes, seen as the University of Zimbabwe now having almost 3 master's programs, one master on social work and social policy, which I am, really pursuing, and promoting. The other one, Master of Family and Child Welfare, Master of Social Work in Family and Child Welfare, and, master, and also another master of social work in master of clinical social work, without, of course, negating our traditional masters, generic masters, of social work. It is also in this context that we've also, I've also, spearheaded a vigorous, attempt to try and promote, nurture, through talent identification, and a number of students onto doctoral programs that also speak to issues of developmental social work, speak to issues of social policy and social protection. What I may also say is that in the same spirit, I've also, as a citizen, done my part and continue to, play a big role in, making sure that, government policy and programs, of a social and even public nature, have got, a human face. And I have tried to seize the opportunity to, consult with government, advising, a number of ministries and key departments to, embrace the empowerment agenda. I've done that through a number of ways, writing policy papers, issue notes, policy briefs, doing presentations, holding symposia, workshops, meetings, do a lot of publications, position papers, and related issues. On the same note, I've also reached out to a number of organizations that have also, given me, and I've accepted some consultative, sort of, position or status with them in order to sharpen their advocacy work, in order to also make sure that, whatever policy work that they do is really evidence-based. Whatever policy work they may do is also, sensitive to the local political, circumstances. Because for me, this is where even the majority of social workers, find it very wrong. A lot of social work advocacy revolves around international, pieces of statutes like conventions, UNCRPD, United Nations Convention on the Rights of Persons with Disabilities, United Nations Convention on the Rights of the Child, which probably in the majority of cases may not find space beyond simply ratification and domestication, in the local political environment of, a number of countries, ours included. So you want to reorganize the general thinking and approach, of social workers, towards the, doing those things that work, in their local context. And the way to go will be to say, yes, the convention is, a broader global, orientation towards a certain social issue. But what works here? What works here is, let's study our politics, and work with it. The way we work with it is, let's also be part of the, you know, uh, um, profession that shapes, the society, that we want Zimbabwe to eventually transform itself, towards, without shunning, without even negating, the, socioeconomic and political imperatives, that, are obtaining, because we will not be able, as outsiders, to correct, the situation. Doc, let's meet next time on other engagements. Thank you. So, last but not least, I may also even say that I've managed in a small way and in a small way to nurture, upcoming young people, towards this orientation, making sure that they like, making sure that they prefer, my model of thinking, making sure that I do research with them, making sure that I do advocacy work with them, making sure that I do police work with them, in the interest of posterity. I thank you.
Thank you. Thank you very much for outlining that. It's quite important that when it comes to disability, you've got a very clear model. And hopefully, listeners, as well as students and practitioners, will benefit from those ideas as well. So once again, thank you very much, Dr. Edmos Mthethwa, for a detailed account of yourself and the work that you have done for the profession in Zimbabwe, in Africa, and globally. Thank you again.
Thank you very much, Doc. Let's meet next time on other engagements. Thank you.
Thank you very much, all listeners and viewers, for taking time to open this interview. Please visit our website, africasocialwork.net, or watch this space for more resources and interviews. That is all for today. See you next time.